Now, an hour to give. From philanthropists to foundations, nonprofits to volunteers, each working hard every day to make our city a better place. Join us as we celebrate the art of giving in Ottawa. Here's your host, Sam LaPrade.
Welcome to An Hour to Give. I'm Sam LaPrade, and each week we come together to talk about community and volunteerism and philanthropy. And this week we're going to be speaking with the Ottawa Hospital, and in studio with me right now is Dr. Paul McPherson. Welcome to the show.
Thank you.
We're so happy you're here, and you're here to talk about a topic that's so timely. We're going to be speaking about gay men's health. And tell me a little bit about how you got involved with the Ottawa Hospital.
I actually did my medical school training at McMaster in Hamilton, and then my initial residency at the University of Toronto. And then I came to Ottawa to subspecialize, become a specialist in infectious diseases. And that's really how I got drawn into gay men's health specifically, is from the angle of treating people with HIV. In doing that, as I went through my practice, both treating people with HIV and talking to gay guys who were negative and trying to avoid HIV, I really came to realize just how much we were missing when it came to the healthcare system interacting with gay men.
And there's just so much. I mean, in research for my show with you today, I thought to myself, wow, there's just so much. And I had no idea of the different angles in terms of even depression and all those types of issues. So can you give me a little bit of an idea of why the Ottawa Hospital felt it a priority to do a research chair, for instance?
Yeah, I'm so excited and so very pleased that the Ottawa Hospital has made this a priority. I think one of the things we at the Ottawa Hospital realized is the importance of personalized medicine. And personalized medicine means focusing on the person and on their context. And I think over the years, we've learned a lot about delivering healthcare to different populations. And we've made great strides in women's health. And we're starting to make some inroads on Aboriginal health. And much the same, there are other populations like gay men where we really need to focus on that population in a very specific way. So when I think about gay men's health, I think really about three things. A, their specific health concerns. B, their life experience and how that influences how they interact, engage, or don't engage with the healthcare system. And then I also think about what's the diversity within the population itself. So when you think about healthcare issues for gay guys, you hit one very directly, which is depression. A couple of years ago, we actually, at the Ottawa Hospital, conducted a survey of gay men living in and around Ottawa. It's really the whole Champlain-Lynn. And we found that 21% of guys actually scored in a validated screening tool as either depressed and or anxious, which is considerably higher than the general population. So mental health is a significant issue for gay guys. It's the anxiety of living as a minority in the general population. There are, of course, other regular healthcare issues, high blood pressure, heart disease, cancer, but even there, gay guys need to know, and healthcare professionals need to know, that gay men are at increased risk of anal cancer. So that's something they need to be aware of and be watching for and be screened for. There's, of course, sexual health, but that when it comes to gay guys, is so focused on HIV, and we need to broaden our understanding of gay men's sexual health to beyond just HIV and STIs, and incorporate things like sexual anxiety, for example, that makes for a better sexual health.
So we sort of think, a lot of people say, oh, men never want to go to the doctor, right? And we sort of think about, husbands that way. And we always, as wives, kind of joke, like, you need to go to the hospital, you need to go to the doctor. And are you finding that gay men are more apt to go or less apt to go?
Well, surprisingly, I thought was surprising from our survey is that I think it was about 90% of the guys in our survey actually had a family doctor. And 90% of that 90% saw their family doctor at least once a year. So we found they actually were engaging with healthcare. But there were two things that kind of also stood out in our survey. One, importantly, is 24% of these guys did not disclose their sexual orientation to their healthcare provider. So they withheld a lot of information. Why exactly? We don't know, but I suspect it's just the anticipation of stereotypes that we all deal with. The other interesting thing was when it came to mental health, of the guys who scored on the validated tool as being depressed and or anxious, a full 55% of them told us in the survey that they felt their mental health was average, good, or excellent. So here we have guys who are depressed, but when you ask them, how's your mood, how's your mental health, they'll say, well, it's fine. So we know that just asking guys, how you doing? And they'll say, fine. You need to dig deeper.
Absolutely. And ask specific questions, I'm
Ask
assuming.
very specific questions.
And what would be some of those questions?
Well, there are, in fact, tools that we're encouraging family docs to use, not just for gay men, but in general, that actually list a number of symptoms for guys to comment on that can really reveal how they're actually feeling to the doctor. And sometimes it's easier to check them off on a little questionnaire than have to do that really face-to-face. Once the doctor has that questionnaire, they can say, hey, look, I see you're not really doing so well. Tell me more about that.
Well, and I think in working with the docs directly and sort of having them see some things maybe in their patients, that would be part of your work as well.
Absolutely. I think the more our healthcare providers are aware of gay men's health issues and the way, again, they interact with the healthcare system will facilitate those discussions.
Well, and I think the multidisciplinary team approach would be important because, like you say, it's mental health, it's physical health, et cetera. Can you speak a little bit more about that?
Absolutely. Well, that's the goal of our research chair, is to take a broad view of gay men's health. And again, not just to to focus on HIV and STIs. It's to look at the whole thing, to look at the epidemiology, to talk to gay men. What are their healthcare issues? What are their concerns? And then look at the mental health, the physical health, and the sexual health.
And give us some numbers. How many people in Ottawa, for instance, would be benefiting from this research chair?
Well, if you just work on regular statistics, we probably anticipate about 30,000 gay guys in the Ottawa, Ottawa as a city, and so many more even around, if we include the surrounding areas.
And the Ottawa Hospital has been at the forefront of research, and they're really breaking ground time after time, and this is no exception. So can you speak to us a little bit about how this research chair for gay men's health specifically is groundbreaking?
So this will be the first academic research chair set inside a hospital that will focus on gay men's health. It will be the first in Canada. There are other institutions in the United States, Fenway at Boston is a good example, where they focus on LGBTQ health. But this will be the first chair that really focuses on gay men's health from within an academic institution.
And what would your role be in it?
Well, I already work in the area. I'm fortunate to hold a research chair in gay men's health funded by the Ontario HIV Treatment Network. But again, our focus is on HIV and gay men. So our goal with the research chair is to build capacity and to bring in someone else, bring in other people. We already have a core of researchers at the Ottawa Hospital that have gathered around to work on this, but we want to build, we want to make this bigger so that not only gay men in the Ottawa area start to benefit from having access to informed care that's free of stereotypes, but then the Ottawa Hospital will become a resource, a provincial and a national resource for other healthcare facilities to learn how to deliver truly relevant and appropriate care to gay men.
Absolutely. And so you've been working with some people already, I'm assuming, over your time. And how has the work you're doing now been successful?
Well, we have a number of research projects going on. As I said, we've conducted our survey a couple of years ago, which really gave us some key information of where we need to focus, what areas in healthcare we need to focus, and how to better deliver that care. Gay guys do face a lot of stereotypes, for example, and a lot of healthcare providers carry those stereotypes, and not out of malice, but just out of misinformation. So a big part of what we need to do is start breaking down those stereotypes for healthcare providers so that they know better how to talk to gay guys, for example. So, we do work on that. We're working in HIV prevention. We're working in anal health, many, many different research projects to try and to improve the healthcare for gay guys.
Well, we have so much more to chat about, and so we're going to come back in a minute and chat with you some more. But I think it's important to know how important this is to our community, and so hats off to you and to the Ottawa Hospital for making this a priority for you. And of course, we're speaking with Dr. Paul McPherson from the Ottawa Hospital, of course, a physician and a scientist in the chronic disease program. So we'll be back in a minute on An Hour to Give.
An Hour to Give will return in a moment on 1310 News.
Welcome back to An Hour to Give. And we've been chatting with Dr. Paul McPherson from the Ottawa Hospital. And we've learned a lot about gay men's health. And really, the Ottawa Hospital is making it a priority. And I'm thrilled to hear that. Welcome back to the show.
Thank you.
And, you know, when I think about research, there's lots of research happening, but the people behind the research, right? There's always someone's life that's going to be changed and saved in many cases. Can you share with me, you know, sort of when you put your head down at night on your pillow and think about maybe lives that you've affected? Can you share with me how that feels as a physician?
Well, I think one of the most satisfying parts of my job is, you know, in my clinics, and in the vast majority of my practices with gay men, when they come in and they say, you know what, you're one of the few physicians I can actually talk to. You know, maybe that's in part because I'm a gay guy too, but I think I'm able to dispel those stereotypes. And if some of you guys come in and say, you know, when I say that to my other doctor, I get a look. Mm-hmm. And the look I give them is a knowing one, you know. So they just come in and they just say, you know, there's just so few doctors I can talk to and just, you know, bear all to without judgment, and then, you know, get my health on track and know what it is I need to do to improve my health. And that's extremely rewarding.
Isn't that what everybody wants, right?
I think it is, which is exactly what we're trying to do through our research.
Wow, it's amazing to me. And share with us a little bit about more of the research that is being done and quite honestly, what you hope for the future.
Well, in terms of the research that we're done, I think one of the things to ground us is to know just how little research there is on gay men's health. What there is, what does exist, is overwhelmingly focused on HIV, as if that is the only health concern for gay men. In fact, if you go to medical school, that's the only time you hear about a gay man is in the HIV lecture.
Oh, interesting.
You know? And then, you know, there's very little Canadian data. The data we have is almost exclusively from the States. And on top of that, all the data comes from large urban centers. So I think that's one of the things that makes Ottawa a great place to do this research. Is Ottawa is a great city of about 1 million people, but we're surrounded by suburban communities and rural towns where we meet gay men in all those places, but living in very different contexts. I mentioned earlier that in our survey, 24% of men didn't disclose their sexual orientation to their healthcare provider. In the core, downtown core, that was 17%. In the rural towns, it was 40%.
Wow. And
when we asked guys who they're actually out to, who knows they're gay or have sex with men, again, in the towns surrounding Ottawa, it was as high as 40% of guys had told no one. So again, we need to learn not just how to interact with gay guys who live in downtown Toronto, we need to know how to interact with guys who live in Hawkesbury and Manotick, and how we engage them in healthcare, and in healthcare that's comprehensive and non-stigmatizing.
And how far do you think we've come since the HIV scare of the 80s? How far do you think we've come? Have we come far enough in your opinion, or is there more to come?
Oh, there's way more to do. Mm-hmm. In terms of delivering healthcare to gay guys, I don't think we've come far at all. I think we're still mired in the 80s.
And you're wanting to change that.
Absolutely.
Yeah, absolutely. And the Ottawa Hospital wants to do that, and they want to do it in a way that is so respectful and you know, so loving towards the patients in terms of researching and getting their feelings on it. So talk to me a little bit about how, you know, we as a community can support that.
Well, the big thing we're doing now is raising funds to establish this research chair, which we're extraordinarily excited about. And I'm very happy to say our goal is $1 million, and we're very much closing in on the halfway mark.
Wow.
So it's happening, it's going to happen. And I am so delighted. I'll be honest, when this whole idea was actually brought up by a community member who said to me one day, well, why don't we have a chair in gay men's health?
I love that.
It was. And you know what? I have to say, I kind of rolled my eyes and said, they'll never wash. Wow. And he took it forward and he took it to the Ottawa Hospital Foundation and the Research Institute. And to my just amazing delight, the Ottawa Hospital jumped on board and said, absolutely, this is important.
And when was that?
That was only about, I would say, between a year and 2 years ago.
Wow!
So it's been really amazing. So we're so excited about our fundraising, and in engaging community in our fundraising.
Because there's nothing that draws a community together more than all coming together and saying, you know what, we see this as a priority in our community too. And I think when you do that kind of fundraising, and you've obviously had huge success, it really does make the project feel more community-centered as well, as opposed to it just being funded, right? It really
Absolutely.
brings community
Absolutely.
together.
We want community to be a big part of this, both obviously in our fundraising, but also, as I say, in engaging the gay community in healthcare and inviting us healthcare professionals into their healthcare.
Absolutely. And it would have taken leadership both at Dr. Jack Kitts, of course, from the Ottawa Hospital and of course, Tim Kluk at the Ottawa Hospital Foundation as well. They would have had to be leaders in this.
They have been. They've been very outspoken and very supportive. And I think that sends a very strong message to gay guys and the community at large that this is a priority for the hospital, and we are very eager to raise the funds just to move this forward.
So I know you're inspiring people because you've inspired me. How would somebody make a gift and specifically direct it to this research chair for gay men's health?
It's incredibly easy. You just do it online. So it's OH Foundation for Ottawa Hospital Foundation. So ohfoundation.ca. Go online, make a donation, and you are able to indicate where you want your donation to go.
Excellent. And when I think about, sometimes people like to make a gift and they want to spread it through the year. So there's probably an option for monthly giving as well.
Absolutely. Yep.
So
the
monthly
foundation's
giving.
more than eager to work with people in terms of their giving.
Well, I can say nothing but good things about the Ottawa Hospital Foundation. I've had a chance to work with them over the years, and I worked there myself many moons ago. I did.
That's fabulous.
And so that's another reason where I'm just really, really proud of the Ottawa Hospital for being in the forefront. So now, Dr. McPherson, I want you to dream for me, and I want you to look forward. Let's go 5 years. And in 5 years from now, so we're sitting together and it's 2023, and tell me what you hope you've accomplished.
I think in 5 years from now, I hope we have a nice core group of people, including academics, clinicians, and community members, who are really forging this research agenda forward, and that we've learned a great deal and that we've learned to deliver good, relevant, comprehensive care to gay guys. And I'm kind of hoping we have a men's clinic. And maybe it's a men's clinic that's for both straight men and gay men, where we as men can come together, much, modeled after women's health.
Exactly.
And it doesn't matter whether you're gay or straight, but we know what issues are more relevant to each group. And we start really delivering really relevant care that's free of stigma and stereotypes.
I agree because, I think about my dad. My dad's passed a couple years ago, but I think about, he just would not go to the hospital. And it became quite late when we realized he had prostate cancer.
Yeah.
So you think about that example, and there's hundreds and thousands, sadly, examples like that. But I love the idea of non-stigmatizing it for men in general.
Yeah.
Yeah, really, really important. So dream for me again.
So
and
10 years?
Let's go 10 years. Yeah,
10
I love
years?
it.
So what I'm hoping in 10 years is that we actually have a much broader view for sexual minorities, and that we can actually have established a clinic specifically embedded into the women's health clinic, but a clinic really directed for lesbians. And there is already a trans clinic at Centertown, but I think we still have an enormous amount of research and community work to do in forging that healthcare agenda forward. So we have a research chair in trans health, a research chair in lesbian health, maybe a research chair in GLBT youth health, so that all the sexual minorities are represented.
Now, you're a pretty fit guy. On September the 9th, are you going to be doing the ride?
No.
No.
Afraid not.
But of course, it's a big fundraising opportunity for the Ottawa Hospital. And I understand people can direct funds to that particular chair through that event as well.
Absolutely. Yep.
So how would someone do that?
Again, you just go online, make your donation through ohfoundation.ca, and direct it towards the chair in gay men's health.
Now, I'm sure someone's listening and watching us and thinking, what is something that I can do? So I'm in a situation, let's pretend, there's a gentleman watching and he's like, I haven't told anybody I'm gay. I'm having sex with men. I'm having, some challenges with my health. What would your advice be to them?
I think there are actually a couple of things they can do. If they're feeling isolated, they can reach out to community. We're very fortunate in Ottawa to have the community group called Max Ottawa. It's a community organization of gay guys who are really dedicated to improving the health and wellness of other gay men. Reach out to Max Ottawa. They have great workers there who and provide links to mental health. So this is where gay guys who are feeling isolated can connect with community. And from perspective of their health, sometimes it takes a lot of courage, but you have to step up to your family physician or your nurse practitioner. Say, you know what, I'm gay, or I enjoy having sex with other men. And if your family doctor is uncomfortable with that, ask them to refer you to someone who is. There's lots of gay physicians, lesbian physicians throughout the city. I'm always here. So reach out to community and reach out to healthcare. And
Dr. McPherson, how would someone reach you?
The best way to reach me is through their family doctor, and they can make a referral to me at Module G at the Ottawa Hospital.
And I want to recap for people as well. So basically today we've been chatting about Gay Men's Health, Research Chair, the Ottawa Hospital. In 30 seconds, if you met with someone on an elevator and you had an opportunity to tell them exactly what you're doing, tell me what you'd say to them.
I'd say that the goal of what we're doing is to ensure gay men receive healthcare that's relevant and meaningful to them, and be welcoming and free of stereotypes and misinformation.
Well, I have to say, I've so enjoyed our time together today, and I'm going to get a chance to chat with more people representing the Ottawa Hospital today. I'm going to get a chance to chat with Lauren. I'm going to get a chance to chat with Tim. And I think their perspectives are going to be really interesting, patients and advocates for this particular research chair. And I think, once again, massive kudos to the Ottawa Hospital and to yourself. And you know what? And massive kudos to the community member who said, you know what, I think this should be at the Ottawa Hospital, and it just makes our city even better than it was before. So anything we can do to improve men's health in general, and specifically, to your point, gay men's health, is a better day for Ottawa.
Well, thank you for the opportunity to talk to you.
Yeah, it's been a pleasure. And thank you so much for joining us on An Hour to Give. We're going to take a short break. We'll be back after this. Welcome back to An Hour to Give, and we've been chatting with Dr. Paul McPherson, of course, from the Ottawa Hospital. And Dr. McPherson was sharing with us that we're hoping to raise about $1 million for a research chair. And I'm now joined in the studio by Lauren Blahout. Welcome to the show.
Thank you, Sam.
And Lauren, you've been a patient of the Ottawa Hospital, and I really appreciate you coming in and sharing your story. I think there's nothing more effective to show the impact of an organization than someone actually giving their story. So we're really grateful for your time today.
My pleasure.
So take me back. To, let's say, when you decided to come out to your family and friends.
Well, that goes back a number of years. I moved to Ottawa from Saskatchewan in the fall of '92. I really didn't come out I was 39 at that time, and it took a 3 years before I finally came to grips with my own sexuality. First of all, admitting to myself that this is who I am. As far as coming out to friends and family, no. The reason was fear of rejection.
Oh, I totally understand. I mean, it was a different time too, right?
Absolutely. So I came out when I was 42. It started when I was home for holidays in the summer. I was going through some difficult times, so at the time I was seeing a psychiatrist for some therapy. And when I came back, I had an appointment with him. And so I went into his office, and he asked me how my vacation went, and I couldn't talk to him. I fell apart. I started crying. And he's looking at me very oddly, and so he's waiting for me to compose myself. It took me 30 minutes.
And that's okay.
I couldn't do it. And the reason I couldn't do it was I was convinced in my own head that if I told him that I was gay, he would throw me out of his office.
What year was this?
Oh, goodness gracious. It would have been 98, somewhere's in there.
We've come a long way.
I have indeed. I must say, though, that I am feeling a little bit of angst today because of the topics we're going to be discussing, which are very personal to me. I generally am a very personal person, and I don't share a whole lot with a whole lot of people. But when I was asked if I wanted to participate in this because of the care and treatment I've received from the Ottawa General Hospital over the years, my relationship with the hospital goes back to 2000. Without hesitation, I said absolutely yes.
Well, I think you're incredible for doing this, and
well, thank you.
Put my hat off to you for sure.
The angst that I speak of is there are friends, former co-workers, I'm retired now, who don't know that I'm HIV positive. And to me, this is a little bit like coming out. So I'm committed to doing this. I feel good about doing this, but there is still that little bit of, hesitation in the back of my head. What are people going to say? At 65 years of age, I should be past that point, but unfortunately, I'm not.
That's okay. That's okay. I'm here with you.
Thank you.
So, Lauren, take me to the year 2000.
Oh, gracious. I had gone to Montreal for my 47th birthday. I was going to celebrate. So I spent the weekend there, and I did meet up with someone, and we did become involved. And before we became sexually involved, I asked him, should I wear a condom? And he said, no. I knew better, but I took him at his word. And so we spent the weekend together. And it was Sunday evening we'd gone out for dinner. And he was very quiet. And I asked him what he was thinking. And he kind of looked past me. And he said to me, I don't think we should have done what we did this weekend. And I was stunned. I looked at him and I said, what are you telling me? And he said, oh, nothing. Don't worry about it. Don't worry about it. I didn't worry about it. This was in April. About June, I was feeling like I had the flu. I was leaving the gym one day, walking with a friend home, and I walked on to the pharmacy. Because I said, I feel like I've got the flu, and it's June. Who gets the flu in June? And so I stopped in at the pharmacy, and I, in fact, made that same comment to the pharmacist, who said to me, you can get the flu anytime. I was feeling achy, and I had sweats, and this and that. Now, I found out after that was the virus taking hold. It was a seroconversion of the virus into my system. The body, my antibodies were in a death fight, if I can put it that way, with the virus. I was tested for HIV when I went for my annual medical in November, and that's when I found out that I was HIV positive. And Sam, I have to tell you, I totally fell apart. I thought, my God, at 47 years of age, you're going to die.
It's heartbreaking.
I went into a depression. I went to work. I did my job. I spoke to no one. I didn't associate with anyone at lunch.
Oh, I'm sorry. It's so isolating. Oh, you're breaking my heart.
I didn't know where I was going to go and how I was going to end up. And the idea of dying wasn't what frightened me so much as having some information as to some of the opportunistic infectious diseases that comes with AIDS.
Mm-hmm.
The cancers, the pneumonias, the visions of having seen on television AIDS patients who were emaciated in hospitals. So I had this all running through my head, and I was convinced that that's where I was headed.
And is that where the Ottawa Hospital comes in?
That's when I was directed to the Ottawa Hospital. I met some incredible people there. First and foremost, Dr. Kravchuk, who is still my HIV doctor. A very empathetic man. He spoke to me and explained that there are treatments available, that he would work with me. It took a while to settle down, as it were, because I was still convinced that my life was limited. I also met through the Ottawa Hospital social worker Kim Lancaster, who was instrumental in helping me through the depression, helping me to look at the disease, and in fact helped me to deal with some personal issues that I had in my life. As the saying goes, I came with more baggage than Air Canada, and I needed help.
Mm-hmm.
So the combination of the talk therapy with Kim, the visits with Dr. Kravchuk, the explanations that I received from him in terms of medications, what they would do, what I could look to down the road. It was a milestone for me once I started treatment that within the year my viral load went from roughly 179,000 to non-detectable.
Wow.
Miraculous.
I'm so happy to hear that. You have no idea.
Thank you.
Wow. I just think you're like the bravest person.
Well, thank you for saying that. My view generally has been in life that sometimes there's no other choice but to get up and do what you need to do, because the alternative is you can lay down and die. I didn't want to lay down and die.
We're glad you didn't.
It was time to stand up and to take the treatment that was made available to me and to run with it.
And what would you say if your doctors are listening and everyone at the Ottawa Hospital, let's pretend they're all gathered around the radio listening. What would you say to them?
Thank you doesn't say it all. I can't express adequately in words the gratitude that I have for that institution, for the doctors there, for the nurses there, the support staff on intake who were always very pleasant and very kind. All I can really say is thank you, but as I said, thank you just doesn't seem quite enough.
What advice would you give to someone that's listening that maybe, hasn't had a chance to sort of deal with their health? We've got about 30 seconds. I'd love you to sort of just some wise words to someone that might be.
Well, I guess the thing that comes to mind is that what you don't know will kill you. And if you have symptoms or you're not feeling well, you need to get it checked out, because I think we all have a responsibility to take some control over our own health care.
Absolutely.
It's important, because if you don't, the results may be tragic.
Mm-hmm. Lauren, I will never forget our time together today.
Thank you.
Absolutely. And, the Ottawa Hospital, it's a leader. It's a leader in our community.
They are indeed.
And I am so grateful that they encouraged you to come today and that you took them up on the offer, because I guarantee you've affected someone today. You've inspired them. And I would go so far as you've probably saved someone's life today.
Thank you. I hope
We'll
so.
be back with an hour to give. Welcome back to An Hour to Give, and we've been speaking with people associated with the Ottawa Hospital and with Gay Men's Health. And, you know, I just spoke with Lauren Blahout, who really shared such an intimate story about his journey with Gay Men's Health and with the Ottawa Hospital. And, you know, Lauren, as we were saying goodbye to each other today, he said to me, I want to make sure people know, Sam, that the Ottawa Hospital took care of my body, absolutely, took care of my physical being, but they also took care of me mentally. And he really wanted to make sure that we shared that. So on behalf of Lauren, I'm happy to share that today. And I'm also thrilled to be joined by Tim Hutchinson. And Tim, thanks so much for joining us.
Thanks, Sam.
And give me a little bit of a background. Why is this chair and the issue of gay men's health so important to you?
Well, I am a gay man, and I've been active in the gay community since the early 1980s when I came out. I was 28 at the time. And as time has gone on, it's increasingly seemed to me that it's a population that really could benefit from some greater focus from a research perspective and an interdisciplinary research perspective. Also, I sometimes get annoyed that people think of gay men's health and they always think of AIDS, HIV. Not that I'm annoyed about that per se.
I understand.
But, there's a lot more around men's health. And I think gay men really pose some really distinct challenges when they come in, or face some distinct challenges when they enter the healthcare system. Many treatment protocols for other things that are not related to sexually transmitted diseases. But also, as time has gone on, as people age, and the needs for gay men really differ from youth right through a whole life cycle. And so there are various research activities that are going on across the country, around the world. But, the opportunity to have a research chair in gay men's health is really a distinct entity. There are other research chairs, but not specifically that would be looking at gay men across the whole age continuum, that is looking at all of their healthcare needs,
Right.
The psychological, the medical pieces, and also those that may be suffering from chronic diseases, other chronic diseases, and the interrelationship thereof. I think the mental health piece, the very fact that men are not good users of the healthcare system to begin with. They
Agreed.
don't usually access healthcare. And I think you add another layer on top of that with when someone identifies as gay. Earlier generations, or my generations, where we were often thought of as criminals or sexual deviants, mentally ill. And so the whole piece of putting your hands in, or your health in the hands of someone else, is a really frightening kind of thing. So how open can I be? Will my partner be accepted? What are the service providers going to be like? And so there's a broad variety of items that I think really we could help develop an evidence base as to how do we really intervene in this. Yes, there are other aspects of gay men's health that are really consistent with men,
Right.
But there is a different twist here. And the other piece is that I think it's a population that hasn't been well recognized from the perspective of, it's not just sexually transmitted diseases that we need to be looking at. It's not just something of a young population, and it really has some lifelong kinds of impacts. And so how do we start to raise the bar around, ensuring that even some of the other programming that's actually done in other disciplines outside of infectious disease, that we've appropriately tentacled ourselves into the orthopedic pieces that are happening, the oncology pieces. What are the screening pieces that really need to be addressed differently from a cancer prevention perspective. Young men around testicular cancers to prostate cancers. Our community also is noted to suffer from some significant challenges in the mental health area, depression, the results of bullying, just that whole stigmatization pieces.
Absolutely.
And so how do we start to deal with that? And some coping strategies that have been established over time perhaps aren't the healthiest ones. So how do we start to look at that? But how do we also start to help healthcare providers really equip them in a way to really move this agenda along forward?
Such a huge piece, right? I mean, you and I both worked at the Ottawa Hospital. I worked at the Ottawa Hospital Foundation, and you worked at the Ottawa Hospital.
I worked there, yes, in social work, and then also at the Cancer Center. So I've seen it from a couple of perspectives, just, helping people navigate that hospital system, but also, getting a catastrophic diagnosis. In the early days, I remember an HIV infection was really, you thought of palliative care as the next piece. It was catastrophic. Many people face that kind of items when they get a cancer diagnosis or other kinds of pieces. So to me, we're really rich for trying to think about, how do we support and move this on? So the chair piece, I think, is really creative, and I give kudos, to the Ottawa Hospital management that are really supportive of this. I'm pleased to hear that some of our fundraising, for our $1 million, we're moving along there.
The bar is moving,
the
for
bar
sure.
is moving. And the other piece is to really get people to think about what that research piece could do. That's beyond the usual ways.
Absolutely.
The other piece that I'm hopeful at doing, is seeing how we can actually assist in that fundraising process. How can I support my community, the LGBTQ two-spirit community? How do we move that? How can I encourage others from my community to give back? But I also think a lot of gay men many gay men have many female friends.
Oh, yeah, for sure.
Give that hello girlfriend.
Yes, exactly.
And so very, very dear friendships. And I think, okay, how can we engage our girlfriends, our sisters, our mothers? There's lots of questions where I think there's a number of people that if we actually could identify, some opportunity, hey, you can contribute and help us move this agenda along too. It's not just men within the queer community moving this along.
So the community has obviously embraced the fundraising piece because I think you're just about halfway there.
We are. From
what I understand. So that's amazing. Because as I was saying to Dr. McPherson, I think when people sort of put forward their paychecks or, not the whole paycheck,
right.
but they put forward money towards a cause, it really becomes a community then.
It does.
So the community that's come together to embrace this chair would be a very important one.
Well, and I also think we're kind of entering fundraising season as you think of United Way campaigns and those kinds of things, where the Ottawa Hospital Foundation is one of the items that people could directly assign their,
absolutely designated.
Their
absolutely.
designated dollars to.
Yeah, absolutely.
So, the other item that I think many people often think, Ottawa's gay community isn't that large, or, why isn't there something like this coming out of Toronto or Vancouver, where we think in Canada of major hubs. But I think, kudos to the Ottawa Hospital. Their infectious disease program has done very groundbreaking work in the early days of some of the medications that we've gone on many generations since then. It's been a location that I think is serving and has the opportunity to do research, not just from an urban perspective, but from a rural perspective, because a lot of people track into the Ottawa Hospital from up and down the valley, and it is that tertiary care center that really does a lot of linkages to other associated health services that people may require. So to really start to think about those kinds of pieces, I think, are important.
I asked Dr. McPherson this exact same question, and I'm anxious to know your answer. Dream for me. Okay. 5 years from now, what are you hoping the outcome will be?
Well, I'd like to see, to me, we just have an initial, we're going after enough monies at this point to set up the chair. But I see this as a really vibrant research chair position that would have some continual funding, that would be multidisciplinary in nature, where we would be taking our great expertise, but also sharing it with other expertise that's happening around the world, that we're doing some key leading studies, not just in medical breakthroughs, but in some of the pieces around building cultural capacity for people, healthcare providers and others. And I see us as a really vibrant research program that has residents, new medical residents, nursing residents, even others from psychosocial support pieces, really wanting to track into the Ottawa Hospital and the Ottawa research community, because we do have some real leadership here. So that's where I see us a little bit farther down the road. I also see us as being more integrated across a number of other medical disciplines, oncology for sure, the mental health pieces. How do we really start to do some other breakthrough activities, you know?
Absolutely.
And it tracks to a good care facility. You know, I think Ottawa Hospital has saved the lives of many of my friends and my family.
Agreed.
You know, because of the expertise that's there. How do we really make that accessible for a gay male community? It's accessible now, but really enhance that and really move the bar.
I love it. Let's do it.
I'd love to do that.
Let's do
Hopefully, you know, some of your listeners will be thinking, okay, how do I fund? How can I
Exactly.
contribute here? What are the
Exactly.
kinds of pieces? You don't need to be a millionaire.
Exactly.
You
Every
know?
dollar counts for sure.
Every dollar counts.
Tim, I have enjoyed our time together so much today. Yourself and Paul and Lauren really sharing, this really groundbreaking research chair with us today has been really, really helpful. So thank you so much for joining us. And I really want to say to listeners as well that exactly what Tim said. You've been inspired. Certainly reach out to the Ottawa Hospital and make a gift, whether it be in memory of somebody or maybe it's somebody that you know is struggling with their health.
Or even move forward. Or as people start to think about estate planning.
Exactly.
You know?
Yeah. Thanks so much, Tim.
All
I
right.
appreciate you
Thank you.
joining me. Thank you so much, everyone, for participating in An Hour to Give. Have a lovely day. Take care.